review it. Gross measurements. And then in outpatient, you're going to have to be a lot more precise. Okay, but even when you're doing a gross measurement, there's still a standard to make sure you're doing it accurately. Okay, so what's our general rule of thumb with manual muscle tests? What do you start with?
That's a range of motion.
Well, we technically do that already with the goniometry.
You start with them doing the motion on their
Active first. We got to see what they can do actively. Okay, because especially if you have someone sitting in a hospital bed, they could be really, really weak. And then you're going to have to do a gravity eliminated manual muscle test. Okay? Hello, Sean. Happy birthday. We're going to be doing some testing of your muscle function. Does that sound okay to you?
Yes.
Okay, so all I'd like you to do, thumbs up, reach up to the ceiling, come back down. Beautiful. Can you do that again as high as you can? Beautiful. See how that was different? First and low. Okay, I'm going to move your arm. Is that all right? Okay, I want you to hold your arm right there. All right, and don't let me move you. Okay, hold. Hold, hold, hold. Excellent, and relax. Okay, and you could do the other side. And hold right there. Don't let me move you. And relax. Okay, so I'm putting them in the position I want, supported, so they're relaxed. Stabilize the proximal segment. Then I tell them to hold, gradual onset, and as soon as I'm done, I support their limb again. Okay, because if you have them hold it up there while you're talking, now you're fatiguing the muscle. Yeah, and the test will not be accurate. Okay, so thumbs up again. Can you come all the way up and back down? Nice. Why am I telling him to do thumbs up?
So that way it doesn't hit
Move what out of the way of what?
the chromium.
Move the what out of the way of the acromion?
Humerus.
What part of the head of the humerus?
Anterior.
In the greater trochanter.
Greater trochanter.
Not trochanter, tubercle.
Tubercle.
I said trochanter 8 times already. I said it wrong.
That GT.
Yeah, GT. Okay, so if you're in neutral, especially if you're in internal rotation, as you reach up, you get impingement. Even if you've got a normal, healthy shoulder. Okay? So be very hyper aware of however you demonstrate it is probably how the patient's going to do it. Okay, so if you just reach up like this, that's how they're going to reach up. And we're trying to minimize their pain. Okay, so we want to do
The Matrix?
Seriously.
thumbs up, no matter who they are, so we don't elicit any shoulder pain. Okay, mind if I move your arm? Okay, I'm going to hold it right here. Same thing, don't let me move you. Okay, hold right there. Good, and relax. Okay, so same thing, think comfortable position for the shoulder. I don't want to bring them up like this, because I'm internally rotating. So I'm facilitating an external rotation with scapular depression, because that's going to give him the best advantage. And least amount of pain. Okay, and then I'm going to do the same thing here. Okay, go ahead and hold right there. Don't let me move you. Okay. You have a different facial expression.
That was when he did this.
I was going to say something I forgot. Okay. How about, can you reach back like that? Very nice. Okay. Go ahead and hold right there. Don't let me move you. Good. And then hold right there. Don't let me move you. Good. And hold right there. Don't let me move you. Okay, so it's best to do it at mid-range. If someone has shoulder pain and can't get up to those ranges, or 90 starts to become uncomfortable, you technically can do a whole set of manual muscle tests with the humerus and neutral.
Oh, okay.
And hold right there. So I'm testing flexion, extension, adduction, abduction, internal rotation, external rotation.
Isometric exercise. And that.
So similar to an isometric exercise, but you can turn it into a manual muscle test. Okay, so there's so many different ways to modify manual muscle tests. So again, just watch the people around you and how they're doing it. Okay, can you go like that? Very nice. And hold right there, don't let me move you. Good. And then hold right there, don't let me move you. Okay, what's the difference between doing it here and doing it here?
Shorten the mid-length.
I've shortened the muscle.
Tricep.
The biceps muscles.
Depends where you're testing.
Yeah, so what's the difference?
You're recruiting more muscles.
Okay, so this is mid-length for what muscles? What are the elbow flexors? Biceps,
Brachialis.
brachialis. And in this supinated position, you minimal recruitment of brachioradialis. Then when we go here, we've shortened the muscles at the elbow. But what muscle is still in mid-length? Biceps. So technically doing the manual muscle test here, you're isolating the biceps. Okay, so if you have a difference between here and here, probably something with the brachialis.
So if you want to isolate the biceps brachii from the brachialis, then that's the positioning you feel for brachialis.
Okay, and then for true triceps, so go ahead and straighten your arm. Good, and come back down. And hold right
Shake the
there.
leg, bro.
Don't let me move you. Very good. What can be an issue with holding the arm like this? Yeah, if they have any shoulder pain, you're not going to want to do the triceps test like that. It'll be easier to do it in prone. Okay, can you bring your hands up like this? Good. Beautiful. Okay, flip back down. Good, and hold right there.
I'm gonna see you at the club on Friday doing that.
Don't let me move you. There we go. Can I see? Hold right there, don't let me move you. And hold right there. So notice for this one, I'm going away from the thumb because I don't want to do thumb compression. That'll hurt. And can you see you go like that? Very nice. And then hold right there, don't let me move you. Good. So what muscle is it just testing? Flexor digitorum profundus, because I was providing resistance at the
DIP.
DIP. If I provide resistance here, hold there. Now I'm testing superficialis. Important distinction for the hand. Also important distinction in neuro. We're going to learn key muscles for each myotome, relating it back to spinal cord function. And this is the one for C8.
I thought that was C7.
No.
No.
This is the dermatome of C7.
Oh, that's what I was thinking.
The myotome of C7 is the triceps.
Extension.
Yeah, 6, 7, 8. It's a part of the dance we're all going to do.
Okay, I did it right. Okay.
He's like, okay.
I'm sweating over here.
You got these people.
Okay, can you lift your knee straight up into the air, please? Good, and back down. Good, hold right there, and relax. What was that?
He almost popped off there.
So we talked about this before. What's the disadvantage of testing hip flexion and sitting? What's the ideal position of the muscle for a manual muscle test? Mid-length. When I have him raise his knee up, is that mid-length of the hip flexors? No, they're pretty shortened. So it's not. If you want to be really precise with measuring hip flexion strength, you're going to do it in supine. Let's try that out again. I think you
It's kind of weak.
Okay, hold right there. Don't let me move you. Hold.
Don't talk about me.
Okay, so again, to do the true accurate manual muscle test,
Better hold it.
You don't want them put their arms down. Also, I have my hand back here to make sure he's not doing one of these.
He's trying.
Because you can fake hip flexor strength by going into back extension. Okay, lift this one up. Good, and back down. Good. Hold right there. Don't let me move
Got
you.
this.
Hold. Good, much better. Wow, that's a big difference I just had. Okay, can you straighten this knee?
That's just leg, man.
Very nice, and relax. And straighten that one. And relax. Yes. Okay, remember for the knee, mid-length. If you let them go into full extension, the tibia locks into the femur, and so it's not true quad strength. You're getting passive stability too. So you need at least, relax, 30 degrees of knee flexion. Okay, hold right there, don't let me move you. Again, quads are a big, strong muscle, so the way I'm doing it is I'm not actually applying force with my arm, I'm applying it with my leg by adducting my leg into my elbow. Yeah, and that one I'll never be able to break them, and relax. Okay, so then same thing here, and hold right there, don't let me move you. Okay, so all my force is from here going through my radius to here, but I'm not actually doing anything with my arm. Okay, can you lift your toes straight up in the air? Very nice, and back down, and that side, good, and relax. Good, and hold right there. And hold right there. Okay, so again, I'm locking out my arm and just leaning into it. Okay, and make sure you're not pushing on the toes, you're pushing on the actual metatarsals. Okay, what's the gold standard for plantar flexion strength?
25 times.
25 single leg heel raises. It is a 5 out of 5. You almost never actually do it that way unless you're working with high level athletes. Okay, so, but, so you're going to kind of have to see, like, ask your clinic or watch how they like to do it. So, since I work with a lot of geriatrics, calf strength is actually super, super important for gait, especially during which phase? Terminal stance.
Favorite stance.
Yeah, every answer on the test will be terminal stance. Okay, so I like to do kind of like a functional observation of how is their calf strength look. So go ahead and stand up, please. And turn and face here. And just hold on to there for stability. There you go. Okay, can you put your toes forward, please? Yes. He's like, are they not? Was I speaking Spanish? You know I don't speak Spanish. Okay, so I want you to go up on your toes as high as you can. Good, and come back down and do that a few times. Okay, so what am I looking for?
Contraction of both calves.
Okay, so I can look at the actual muscle tone. What else? How high he's going, and if it's even bilaterally. Okay, so usually with my Jerry's, I have them do a minimum of 10 bilateral heel raises, and then ask them how they feel. So let's do 3 more.
I look for weight shifting.
True. So, where? How do I want to pose this question? So relax. Actually, let's do this all together. Everyone stand up. Put your toes straight ahead. Hold on to something if you want. And just stand on your feet normally. Okay, when we're just in a normal stance, where should your weight be distributed on your foot? Heel, big toe. We usually say it's a triangle. Heel, big toe, fifth toe. Or fifth metatarsal. Base of the first metatarsal, base of the fifth metatarsal. Okay, if we're about to go on your toes, where do you need to shift your weight? anterior away from the heel. Okay, so the first, and it sounds obvious, but you'll see people do some weird things. So first you need to shift your weight anterior so that you can lift up on the heel. But then what you'll see when you come down is this huge swing back onto the heel. And so then they start to use momentum to go up and down on their toes. So if you see someone and they're going to be going forward, no, go up on your toes, and then they'll swing back. Forward, up, and then they'll swing back. So I'll actually just block them here so their pelvis can't move, and then make them go up and down on their toes. And then you're getting true calf strength. Okay, and then I heard someone else mention it. So once we shift our weight forward to go up on our toes, do you want more on the first or more on the fifth? On the first, because then why? What muscles do we recruit when we put more weight on our first met head during a heel rise? Tibialis posterior and the peroneals. Longest and breadest. Okay, so you can look for all of that as they're doing the heel raise. The second they start not going as high, I would consider that when they fatigue. So I'll often document plantar flexion strength as, fatigued after 8 bilateral heel raises. And then that's my measure, and then I'll retest it in a few weeks to see if they've improved. Okay, but figure out how your CI does it and go with what they do. Last thing we could test easily, so have a seat again. Can you go ahead and just bring your leg up like that?
Sure.
Good, and relax, and now bring it up like that. Good, and relax. So now let's do the same thing on this side. Bring your foot in, and down, and foot out, and down. Okay, hold right there. Don't let me move you. What am I testing for? That's external rotation. Hold right there. Don't let me move you. Don't move. Don't move. Hold right there. Don't let me move you. Hold right there. Don't let me move you. Hold. I'm a rotator. Okay, so we did all shoulder motions. We did mid-range elbow flexion, biceps elbow flexion, triceps, wrist extension, wrist flexion, radial and ulnar deviation. Test the difference, middle finger, FDP versus FDS. Okay, and then we did hip flexion, hip internal, external rotation, knee extension, dorsiflexion, and then the heel raises.